afternoon, everyone. So I am Dhanani, and my practice is My Dental Touch, and our med spa is My Wellness Studio. So I'd like to share with you a little bit about today I know Dr. Patel went into depth about Emface, but how we have utilized Emface in our practice, in our dental practice for aesthetics, but also being able and being very instrumental in treating TMJ. So I practice in Leesburg, Florida, and I've been practicing for over 27 years. And my practice is I provide comprehensive care. We do bread and butter dentistry, but I also do full mouth reconstructions. I do some cosmetic cases. I do place implants, do surgeries, do a lot of different areas of dentistry. I also treat sleep apnea, so I am very focused because I like to treat comprehensively and holistically to help improve our patients, not just aesthetically, but also functionally and holistically. So this is our practice, and I think having a strong team is very important. And since we've been in practice many years, we have patients that have been with us for 15, 20 years, and you develop relationships with these patients. They trust you, and when they trust you, when you embark on new adventures and when you add different services or procedures in the practice, they trust you because they have a relationship with you. And we have very strong relationships, and I have a very strong team that also, when they believe in you, they also instill the same values and the same care to our patients. You have to provide a very welcoming and enriching experience, and then that's what I think helps us become successful. Another thing about the care that we provide, I've always wanted to treat patients very holistically and naturally in ways to help with regeneration. And we do that even in our dentistry when we do implants, and I know earlier we talked about doing PRP, and we use that every day when we do our surgeries and our extractions, because I just think that that's the future, and that's how people want things that are very natural. So we love technology, and we've always used technology in many areas of our dental practice. We use technology. We have a CT scanner that we use to help with diagnosis when people come in pain. We use the CT scanner to help with placement of our implants. We use scanners instead of impressions. We have 3D printers in our practice. We also do digital smile design when we design their smiles with Invisalign therapy. It's all based on function, and that's a big core part of our practice. So 2 years ago, we started our med spa. And when we started our med spa, one of the things that was most attractive to us were actually the BTL devices. And that's how we started. And what was most attractive about the BTL devices is that these are energy-based devices that are very streamlined. They're very effective. They're easy to use. They're delegatable. And they have a lot of clinical research that makes us feel confident because we know we're providing treatments to our patients that are effective and result-driven. So when we treat a patient, whether we're going to give them a beautiful smile of veneers, whether we're going to whiten their teeth, or whether we're just fixing one tooth, we hand them the mirror. And when they look in the mirror, what do they see? They have this beautiful smile. We're trying to showcase what we've delivered, and they focus on the wrinkles around their lips. They focus on their jowls. They focus on their eyes. And we're trying to make them feel good about themselves, but we all are aging, and we're all very aware of that. And when we start to see the loss in structure, when we start to see the loss of support in our face, it becomes very evident in all the different layers of the face, whether it's the skin, the muscle, the fat, and also the bone. And it's very clear, and it's like, how can we make people feel confident? How can we make people feel good about themselves? And something that I've learned early on in my practice is when you help a patient feel good and look good, they transform. They start to take better care of themselves. They start to change. And you see that because in dental practice, we see patients every 6 months when they come in for their cleanings. So when you see them 6 months later or a year later, you see the patient evolve as a person. And that's what I think actually makes us very passionate in providing care to these patients. So we always want to provide services that help with anti-aging and rejuvenation and naturally. And this also relates to not just aesthetics, but also function. So when we have the lack of support and as we age, it affects our jaw. And then that translates to the joint, which we will talk about in a little bit. So how does dentistry, specifically for me, but how does dentistry and aesthetic wellness, how does that relate and translate? People ask me all the time, well, why is a dentist doing all these procedures? Well, why are you doing all these procedures? And what I explain is that dentistry, our mouth is the beginning of our overall health. When you have a healthy mouth, it relates to your body. We all know that gum disease, periodontal disease, is a systemic disease. It's inflammation. It's very strongly linked to cardiovascular health. It's linked to many precursors to so many different kinds of cancers. So it does relate. You can't just treat one part of the body alone. It's all related. So when we work on improving a person's mouth or their teeth, we are impacting their overall health, but we're also impacting them mentally. And we've heard about all the different areas of mental health. But when we feel confident, we take better care of ourselves, and we improve our confidence, we improve our how we optimize our everyday life. So it's very, very, very much related. So what makes Emface the perfect fit for my practice? Actually, what makes Emface the perfect fit for any practice? So you don't have to be a dentist or you don't have to be in aesthetics to provide these services to patients. Every single week, I get a patient that comes in that has pain in some way or another. We all are always wanting ways to improve how we're aging. So it fits for anybody, no matter what type of practice you have. So Dr. Patel very informatively went into all the details of Emface, but I'd just like to touch on a few key points. So when we started our med spa, we started with the Emface. And what was so amazing about Emface, we have a very large practice, we have a lot of people, we have 25 team members. And so what was great about it is that it's so easily delegatable. You don't need any special skills to be able to deliver these services to our patients. And they are very comfortable, there's no downtime. You can come in and get the lunchtime facelift, as it's called sometimes, but it's very effective. And now that we have such great functional outcomes from it, it's even better. What does Emface do? It combines two novel technologies, radio frequency synchronized with high-fest technology. And both of these together help with muscle tone, help with strengthening the jaw, help with wrinkle reduction, and also help with fat reduction. And I'm glad that Dr. Patel spoke about that because when we reduce the fat in our chin area, indirectly, it has not been, of course, we don't have published studies on it, but it very much is related to breathing. And as dentists, that is something we notice all the time, and it's something that's often discussed, and it's becoming so prevalent, is the increase in breathing, airway, and sleep apnea. And so I think that's huge because everybody hates that double chin, but not only that, by reducing that double chin, we're actually helping patients breathe better. So this is huge, huge. So the muscles that are treated with Emface are, of course, we know that it's the upper face, the mid face, and the lower face. And traditional Emface treats the elevator muscles, which we talked about the hammock, but when we treat Emface in a different protocol that we'll hear about, we're actually treating different muscles, which are the muscles of mastication. And when we treat the muscles of mastication, that provides structure and form and posture, and it actually aligns our jaws. So I want to start with sharing a story about a patient. This is a patient who came to me, and this is not just somebody that doesn't take care of herself. She is a jazzercise instructor. She has always taken care of herself. She is very focused on treating herself to reverse aging, but she was in braces for 3 years. She was a severe clencher and grinder, and her biggest complaint, she came to me actually as a second opinion, and she came to me because she said, whenever I smile, it looks like I have baby teeth. I have these tiny teeth. And when we evaluated her mouth, there was complete erosion, her teeth were tiny, they were severely worn down, she had lots of broken teeth in the back, and she goes, I just hate this, but haven't found a solution on what can help me. So my evaluation She needed a full mouth reconstruction. We fixed her teeth, and I handed her a mirror, and she goes, oh, I love it. I love my teeth, but I still am not confident. I'm still not satisfied. So if we look at the before photo, it's actually, we can look at her, and you can see the sagging in her face. You can see how her cheek is so depressed. You can actually see everything sort of hang below. You see her jowls. You see her sunken eyes. So then, of course, we have Emface. Now, when I treated her, the only applicators that were out were the cheek and the frontalis, so that's all we treated her with. But look at the after. 4 sessions of Emface and Exion. Look at her face. Her cheek. She has such a nice sculpted jawline. Her eyes look amazing. Her neck has changed. And not only that, but look at the tone and the texture of her skin, because Emface helps with elastin and collagen stimulation. And what she wanted, she's had dermal fillers in the past. She didn't want therapies she didn't want injectables. She wanted natural, regenerative, anti-aging treatments. And now, it's been at least a year since I've treated her, and she says, I get compliments all the time because my smile is beautiful. I feel good, I'm confident, and none of this would have happened. She goes, this has actually truly changed my life. So that's the cosmetic part of the Emface. But now, let's talk about functional Emface. So this has been huge. Just a couple of months ago, Emface has actually been cleared to treat TMJ. So we're going to talk about TMJ. And another thing that's actually very alluding to that is that November is actually TMJ Awareness Month, so I think it makes sense for us to learn about this. So what is TMJ? TMJ is the joint that actually connects the mandible, the lower jaw, to our face. And it's that joint that actually, when people have pain or they suffer from some type of dysfunction or disorder of the joint, they have headaches, they have pain, many people can't eat, they can't sleep, they get popping, clicking of the jaw, they get headaches, they get neck pain, they get tightness in their muscles, and it's very debilitating. Patients come in, I get referrals from other dentists, I get referrals from other medical providers. People come in with pain, and there are not many solutions. So it's amazing to be able to provide this for patients. But what is the main cause of temporomandibular disorder? TMJ is the joint, TMD is the disorder or the dysfunction. So what is the main cause? The main cause of this is tightness, is typically muscle related. It's tightness and strain in the muscle. And the muscles that are affected are mostly the masseter, the temporalis, and the pterygoids. Those are the main muscles that are affected by the TMJ, and they're all innervated by cranial nerve number 5, the trigeminal nerve. So when we treat this, we're treating those specific muscles and we're treating that specific nerve. 1 in 12 Americans suffers with some form of TMD. So I'd like to just see a show of hands. How many people in the audience have ever had a history of clenching, grinding, headaches, ear pain, jaw pain, all of these conditions? It's very prevalent. You see it everywhere. And it's so common. And there aren't many different solutions. When we have poor posture, when we have trauma, when we have stresses, all of these things are related to the pain. People come in sometimes with a toothache, and they think they have a bad tooth. When we do an evaluation, it's actually from clenching and grinding. But TMD is growing in prevalence dramatically. So why is it growing in prevalence? One of the main reasons is because of our screen time. We have forward head posture. We're always down. We're looking at a tablet or a phone. We're working on the computer, and that puts a lot of strain on our jaw. And when we don't realize it, when we clench and we grind, and many times we don't even realize we do that until we become conscious of it. And I think we're also going to see a greater incidence of this because our younger generation, in the next decade, 1 or 2 decades, all of our children, they're all looking at a phone. Their heads are down all the time. And we're going to see this increase significantly. Another thing is also our diets. Our diets have so much more processed foods. We're not eating as many fruits and vegetables. And that also affects how our jaw forms and develops. And if our jaw doesn't develop and form properly, then we're not using our muscles properly. And they're not being developed. And then that can lead to all of these different conditions, the headaches, the jaw pain. It's difficult to sleep. It's difficult to focus at work. It's difficult to focus at school. Yawning, eating, everything is impacted. So it's huge. It's huge. And then it also affects our focus. It affects jaw, it affects our range of motion, and it affects drug system. At any given time, there are 40 million people in America that are suffering with some form of TMD. And at least annually, at least $4 billion is spent to treat TMD. So I actually don't think that number is correct, because I think that's probably much higher, because so many people don't search out treatments, because they don't know what to get, and they don't know where to go to get treatments for this. And in addition, that says $4 billion, but you know, how much of that money was actually successful? How many people really did get successful treatment out of that? So I think it's actually kind of skewed. So what are the current treatments that we have to treat this condition? You can make them a night guard, you can make them a splint, but that's a Band-Aid. All it does is it just helps you when you're sleeping at night. And that's if you're wearing the appliance. If you don't even wear it, half the times people say, oh, it's in my bed, or I couldn't get used to it, or it's in the drawer and I never put it in. So that's only a Band-Aid to kind of help, but it really doesn't resolve the issue. You can do TENS treatments, but those are multiple treatments, and that's also not very effective. You can get Botox for your TMJ. People get Botox in their masseters all the time. Sure, that's possible. You spend hundreds of dollars, and it has to be done every 3 months. But think about it, I actually think that's actually a very short-term solution. I don't even think that's a good solution, because repetitively treating your masseter muscles with Botox creates muscle atrophy. So you're actually helping you're wanting us to actually develop the muscle, but we're actually causing atrophy. So I think that long-term, that actually makes the TMJ worse. So we're really not helping the patients at all, where they're just spending money on something that's not really a solution. And then of course you have surgery. Well, who wants surgery? Surgery is invasive, it's expensive, there's downtime, and it's unpredictable. And then of course medications. You have side effects from medications. So let's look at the technology that is part of the TMJ protocol with Emface. It uses this same synchronized radio frequency with HiFES technology, but the main difference is the HiFES technology is actually ultra low frequency. So how that's different? HiFES frequency stimulation actually helps with relaxing the muscle, and it helps target specifically the muscles of mastication and the trigeminal nerve that innervates those muscles. So it helps with relaxation, it helps take away the tightness and the stiffness in the jaw and the muscles, and it improves range of motion. And the radio frequency is actually heat energy. And that radio frequency, the heat, improves vascular blood flow, it improves vasodilation and muscle relaxation. So it's kind of very similar to like when you go to the gym. If you lift heavy weights, you gain muscle strength. When you do low weights, you actually increase mobility. So it's a similar analogy. So if we compare the two different protocols of cosmetic or aesthetic TMJ, aesthetic Emface versus TMJ Emface, the main difference is your HiFES frequency. With the aesthetic frequency of HiFES, it's actually 250 hertz. And with the TMJ protocol, it's only 0.67 hertz, so it's actually a very, very low, ultra low frequency. And what that does is it provides a very gentle stimulation to the muscles that helps decrease the tightness and improves range of motion. And it helps take away that strain that's in the muscles associated with either clenching or grinding. where versus the Emface traditional protocol actually has so much more stimulation that actually helps with sculpting the jawline and helping enhance the muscle tone and increasing that. And that specifically treats the elevator muscles of the face that get depressed versus the TMJ that actually treats the muscles of mastication. And the application, the position placement is quite different. In the cosmetic treatment, the applicators are placed towards the smile line, and when we treat the TMJ, we're specifically placing it right on the joint and the masseter muscles and the temporalis more vertically. So I was actually very fortunate to be one of the first providers to be a part of the studies that were used to gain clearance for Emface for TMJ, which we just received. And when we treated patients, we treated them with 4 sessions, 1 week apart for 20 minutes. And what we noticed from treating these patients is that we had significant reduction in pain, range of motion, muscle spasms, and relief, which was huge. The results showed that there was 73% reduction in pain and 5 millimeters increase vertically in range of motion on average, and 7 millimeters in increase in range of motion horizontally. All patients had satisfactory results with function of chewing, eating, and pain reduction. So it was huge, and all of this is done with 0 side effects and very comfortable treatments and immediate relief. When they come in otherwise to get a guard or other treatments traditionally, they don't go home with any relief. We tell them to take ibuprofen. But now patients can actually get relief the same day when they come in with pain. So this is one of my patients that actually was part of the study. And these pictures are actually very powerful because if we look at the baseline photo, just look at her facial expression. Look at the strain in the bottom part of her jaw. Look at the strain in her eyes and her nose. You can tell that she's so uncomfortable. She could barely open for us to measure how much she was able to open her jaw. And then we look at the 1 month follow-up after her 4 sessions. This is 1 month after the last session. She had an improvement of 10 millimeters in opening. That's a whole centimeter. That's big. That's like much more than even our finger. And then at 3 month follow-up, she had a sustained 7 millimeters range of movement opening in her jaw. And actually, these photos are old because I just saw her a couple of weeks ago. We are 7 months past treatment, and she says, I'm still comfortable, I have no problems, I'm able to open and close my jaw comfortably, and I'm very comfortable. And this is 7 months post, so I just think that the results have actually been phenomenal in our practice. So I want to share this little testimonial of one of the patients that we've treated. If we can play that video.
So I was diagnosed with it back in my 20s, but at that time there really wasn't any type of treatment offered for it. So I had that treatment and it was 4 sessions. It was very relaxing. You almost wanted to fall asleep in the chair. Didn't hurt at all. You felt little impulses in your face where the pads were, but it wasn't uncomfortable or painful at all by any means. But I noticed after each session that I was no longer popping in my jaw, that I was able to open my mouth more. It's now been 3 months, and I recently had a dental procedure done, and I noticed that my jaw was not as fatigued, which has been awesome. So no more headaches or the popping. I'm able to open my mouth very wide without my jaw popping, which is so much better than it used to be. At the conclusion, this long out, I would tell anyone that has TMJ, you definitely want to come and do the Emface treatment. It is painless and it works. It worked for me, and I'm so happy. I could not be happier, and I would recommend it to anyone that needed that type of treatment.
many patients that have had relief and have had improvement with 0 side effects and comfortable, long, sustained results. So how can Emface impact all of our practices? So first of all, we're providing a service to patients that not only is helping them aesthetically and cosmetically, but is helping them feel better. When we feel better, we have our most optimum life. We are able to enhance everybody around us. It's a ripple effect. We feel good, and then, in effect, we actually take better care of ourselves. So it's huge. So it impacts us aesthetically and functionally. And we're providing a service. So it's actually a service that will enhance our business, because we all are running a business, and we need to be compensated for that. And then another part of Emface is also that it can actually be complemented with other aesthetic procedures. Like we heard about Dr. Patel mentioned, patients can still get Botox in areas of their face that they wanted to cosmetically. So it can be complemented with so many things, but the best part about it is that it's very comfortable, it's non-invasive, there's no downtime, it fits in everybody's lifestyle. So with one platform, we have 2 outcomes and 2 different applications. So it can make our patients feel their best naturally. And then as far as looking at it from a business, we can get benefit from 2 different areas. When patients are in pain, they will seek treatment, and they will come in and they will pay for whatever it needs to get them out of pain. So patients are looking to age gracefully, they're looking on ways to reverse aging, and they're looking at ways to be comfortable and to be able to function effectively and comfortably. Many sessions, your treatment packages can range anywhere from $3,000 to $6,000 based on how many treatments they receive, or based on what is recommended for them. And also, everybody needs maintenance. So maintenance for cosmetic Emface can be 1 session every 6 months or every quarter, whatever the patient desires. And when it's for TMJ, it could be 1 session every quarter or every 6 months as well, based on their needs. And the market demand is rising. So many more people are, there's such greater increase in prevalence of TMJ, and I actually think that when more people find out about how therapy can be provided so effectively and comfortably, I think the demand is going to significantly increase. It's just a matter of educating patients and letting them know what is out there. So this is another story I'd like to share. This is another patient of mine. And when she came in, we can see on her lower right side she's missing some teeth. So she was heavy clencher grinder. She actually had 2 implants there that were placed probably a year before she came to me. And she came in because she broke her bridge. And when we evaluated her bridge, she actually lost her implants that were integrated. And when implants are integrated, they're like concrete. But she lost them because she was clenching and grinding so severely. She always had headaches, she always had pain in her jaw, and she had invested so much money in her mouth that actually she was losing. So when she came in, and she had lost those teeth, she also had lost a tooth on the upper left, which had another implant, and things were failing. We evaluated her, and we actually treated her first with the Emface to relax her jaw and to relax the tension and the tightness in the muscles. We did get some relief there. Once we got that relief, we're like, okay, she goes, I need teeth and I need to fix my teeth. So we ended up doing a full mouth reconstruction. She also wanted some aesthetic procedures. So we restored her smile. And we've completed that. Once we finished that, when we get in the mirror, she goes, it's great, but you know what? I want to do more for myself. I want to look better. I want to make some changes. So she actually lost like 60 pounds. And she lost 60 pounds, and she has completely changed as a person. And now that she has these new teeth and she's more comfortable, we treated her with Emface cosmetic afterwards and Exion, and look at herself. In 1 year, she's dramatically changed. She goes, this has changed my life. See, she is a much better version of herself. And now that her jaw is in a better position, she's actually going to protect her teeth. And she will protect her teeth, she will protect her restorations, and she's in a much better condition. And this patient, when she would come to our office before all of this, at the very beginning, she used to come in like just shorts and an old t-shirt, and that's how she always looked. But now, whenever she comes to our office, she looks like a completely different person. She has a whole new wardrobe. She walks in and she has so much more confidence. The way she speaks, the way she interacts, that we can't even imagine that she was the same person. So it has changed her in so many ways. And I just love that, seeing a person transform and change by just making them comfortable and to improve how they look and how they feel and how it impacts their life. So this is my team. This is the team that has supported me. This is the team that makes everything happen. This is our med spa team, and this is also our dental team. And it's work, but when you have a great team around you, you're able to deliver and you're able to care for your patients, comprehensively. And of course, none of this is possible if we didn't have the backbone of BTL. We started our med spa with BTL, and they have always been there for us. We have the bus tours. They help with so much with support and successful support. They're always there for us whenever we have different events or different things with education and so many aspects. So thank you, BTL, for helping us be successful. And so that's everything about what I can share. And thank you for listening to me. If there's anything that I can add or anybody would like to talk about anything, I'm open and I'm free, and I'm happy to share. So just let me know. Thank you.